everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with very important MCQs which are helpful for your competitive exams. Who all have visited first time on this channel, please do subscribe and watch. We'll see the first question. A patient is receiving their first unit of packed red blood cells. After 10 minutes of transfusion, the patient reports feeling hot and develops a temperature of 101 degree fever Fahrenheit. What is the nurse's priority action? Options are here. Right option is B, that is stop the transfusion immediately and maintain IV access with normal saline. Next question. During blood transfusion verification, two nurses must check all of the following except previous transfusion reaction history. Next question. A patient develops rigorous fever and hypotension 30 minutes into a blood transfusion. The nurse suspects which type of transfusion reaction? Febrile non-hemolytic reaction. Next question. Before starting a blood transfusion, the nurse must ensure all the following except patient has been fasting for at least 4 hours. A patient receiving iron supplement therapy for iron deficiency anemia should be taught to take iron on an empty stomach with orange juice. Next question. During the first 15 minutes of blood transfusion, the nurse should remain at the bedside continuously monitoring for reaction. Next question. Which assessment finding would be most concerning in a patient with severe anemia? Tachycardia and chest pain. Next question. A patient experiences sudden back pain, chills and red colored urine during blood transfusion. These symptoms indicate acute hemolytic transfusion reaction. The maximum time limit for completing a blood transfusion is 4 hours. Which intervention should be implemented if a patient develops urticaria during blood transfusion? Stop transfusion, give antihistamines, may restart if symptoms resolve. Next question. The most common type of anemia worldwide is iron deficiency anemia. A patient receiving blood transfusion develops sudden dyspnea, bilateral crackles, and jugular vein distension. The nurse suspects circulatory overload. Before blood transfusion, the nurse should assess for previous transfusion reactions and current medications. Next question. During medication administration, a nurse discovers a patient's wristband is missing. What action reflects best nursing practice? Obtain a new wristband before giving medications. A patient with pneumonia is prescribed azithromycin 500 mg per oral daily. On day 3, the patient develops diarrhea. What is the nurse's best response? Assess stool characteristics and frequency. When caring for a patient with acute myocardial infarction receiving nitroglycerin IV, which assessment requires immediate action? Blood pressure 80 by 50 mm of Hg. Next question. A patient is prescribed warfarin 5 mg daily. Which laboratory value indicates therapeutic anticoagulation? That is INR 2.5. When administering insulin by sliding scale, which fundamental nursing principle is most important? Check blood glucose level immediately before administration. Next question. A patient with heart failure shows signs of digitalis toxicity. Which electrolyte imbalance most likely contributed to this condition? Right option is hypokalemia. Next question. During blood transfusion, a patient develops fever, chills, and back pain. What is the nurse's immediate priority action? Stop the transfusion immediately. A patient with COPD is prescribed ipratropium bromide inhaler. What teaching point is most important? Rinse mouth after each use. A patient with chronic kidney disease is receiving epoetina alpha, that is erythropoietin. Which laboratory value requires immediate nursing attention? Blood pressure 180 by 100 mm of Hg. Pneumonia patient on IV meropenem, cofenatin and saline nebulization is lethargic. Heart rate is 110, sodium 120, that is MEq per liter. Right option is B, that is stop unnecessary fluids, monitor sodium, check for SEDA and then medication induced hyponatremia. Next question. Elderly congestive heart failure patient on digoxin, amlodipine and furosemide develops visual halos and then slow pulse and confusing after starting erythromycin for UTI. Hold digoxin, check levels, monitor for erythromycin digoxin interaction. Liver cirrhosis patient receiving lactulose, spironolactone and IV cefotaxime for peritonitis develops confusion. Asterixis K plus 5.8. Hold spironolactone and then continue lactulose and cefotaxime. Start measures to lower potassium. IV drug user with endocarditis is on gentamicin, vancomycin and IV furosemide and then develops new hearing loss and rising creatinine. Right option is B, that is hold gentamicin, monitor renal and auditory function, reassess furosemide. Cancer patient on cisplatin, metoclopramide and omeprazole develops muscle weakness, constipation. ECG flattened T waves, potassium 2.8. Right option is D, that is hold cisplatin, supplement potassium and then monitor ECG, releases GI drugs for interaction. Next question. Myasthenia gravis patient on pyridostigmine, prednisone and ceftriaxone develops fever, muscle weakness and shallow breathing. Right option is B, that is assess for myasthenia crisis, ensure airway and support continue, meds as medications as ordered, monitor infection. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.